This program is an MS Views and News program. My name is Stuart Schlossman. I'm president and founder of MS Views and News, and we are the sole sponsors of this program, and we take care of Dr. Boster, and we enjoy that he's here to educate the MS community. So I'm going to let him take it away. It's 7:03. Let's see how long he can talk before we go to Q&A. Okay? Thank you.
Thank you, Stuart. Thank you, MS Views and News, for the opportunity to have the virtual equivalent of like a fireside chat. Good evening, everyone. Aaron Boster here, visiting you from sunny Columbus, Ohio, where it has been bitter, brutally cold out. It's the first time in my life I had to shovel in 3 different layers to get down to the driveway. At any rate, I'm super excited to be here with you today, and the topic of our conversation is wellness and lifestyle. And that's a really, really important conversation. If you want to live your best life despite having MS, if you want to make MS boring, it takes a multi-pronged approach. And it's really, really helpful to take an MS medicine, but taking an MS medicine by itself is not adequate to live your best life with MS. And many of you that have spent some time with me before have heard me talk about being 5 for 5. And I always like to remind people, when I tell you that I want you to be 5 for 5 in your fight against MS, and I say there's 5 things that can slow it down, 4 of them are not a medicine. Only one's a medicine. My point here is there's a lot of stuff that we need to be thinking about and doing actively as part of your lifestyle if we're going to make this disease boring, which is really my goal. So today, we're not going to be talking about disease-modifying therapies. Today, I'm not going to be talking about symptomatic medicines. We're not going to be really discussing medicines at all. Instead, I'm going to focus on lifestyle, behavioral measures, diet, exercise, sleep, mindfulness, things that you need to be avoiding to help you live your best life. So get out pen and paper and let's hop to it. Unsweetened iced tea is amazing. All right. So when I'm thinking about lifestyle in MS, when I'm thinking about things that I want families impacted by MS to be considering, I'm going to talk about 5 of them. And it's not my 5 for 5, it's 5 separate things. And each of them in and of themselves could be its own discussion. So I'm going to briefly talk about each one. And then maybe in the Q&A, if you guys have specific questions, I would be more than happy to field them. So I'm going to talk about food. I hate when allopathic doctors, I'm an allopathic doctor, when allopathic doctors say dumb stuff like it doesn't matter what you eat. I've literally heard a doctor say, go ahead and eat McDonald's, it makes no difference, which is really false. That's not true. It does matter what you eat. And time again, I have found that when we start to adhere to a healthy diet, I'll explain what I mean by that in a second, really good, weird things start to happen to my patient. Symptoms improve. Some symptoms melt away. Some things get better. And I wish that I could bottle it and have you experience that. Well, let's talk about it a little bit. Very commonly, when someone is diagnosed with MS, one of the first things they do is they start to look at diets, and they find immediately all of these like well-known, very popular diets with varying levels of science or lack of science behind them. So sometimes people will read about the Walls protocol, or they'll spend a bunch of money and buy a book written by her. They'll learn about other diets like overcoming MS. There's several, the Swank diet. And it can get really confusing because one diet says, for the love of God, never eat meat or you'll explode. And the other diet says, you can eat meat. And the one diet says, well, don't eat dairy. If you eat dairy, that's bad for MS. Then the other diet says, you can have dairy. And it can leave a person a little bit confused. What I have found is when you look at all of those diets, there are some common threads. When you look at all of those diets, the biggest common thread that I see is you're talking about whole food, real food, single ingredient food. That's the common thread. And if you were to make a lifestyle change to really do something different with eating, it's not that hard. I'm not looking for you to go in your pantry and throw everything out and find a new grocery store. That's not what I mean at all. But I want you to start to think about what you're eating in the context of your health. So let's start to get a little bit granular. A couple things that I want you to think about. Number one is water, right? I know that I talk about water all the time, but there's a really good reason. upping your water game helps you manage MS symptoms. It actually makes your bladder better. It makes your bowel control better. It makes your spasticity and your pain better. It makes cognition better. It makes energy better. So drink water. I'm really wanting you to drink 68, upwards of 100 ounces of water a day, which is a tremendous amount of water. We're not going to start off doing that right from the get-go. So what I would recommend that you do, if you're not a diehard water drinker yet, is simply add 1 glass of water with each meal you have. So if you have 1 meal a day, 2 meals a day, 3 meals a day, whatever that is, have a glass of water. So you're going to have cheeseburger, French fries, Coca-Cola, water, all right? And then I want you to drink a glass of water between each meal. So you finish breakfast, you got 4 hours before lunch, drink a glass of water. The second thing that I want you to do, checking with your doctor, is to supplement your vitamin D. So when I look at the data, lower levels of vitamin D correlate with worse outcomes in MS. And we get vitamin D through a chemical interaction with the sun in our skin, unless you live in Ohio where there's not a lot of sun. And so I want you to take a vitamin D3 pill. D3 is the most active version of vitamin D. And I like to check blood levels in my clinic, and I like to drive that level up above 50. So just to get in the door when we're talking about diet, we're going to up our water game, and then we're going to supplement vitamin D. After that, it gets a bit hard. After that, I really want you to identify ultra-processed foods, sugar-laden foods, fried foods, fast foods, diet foods. These are things that we want to try to remove. Now, it's literally impossible to remove them all, not with an American diet. But what you can do is you can pick one ultra-processed food or one maybe not so good for you food, maybe one food that has a bunch of ingredients that are all chemicals that you can't pronounce, and swap that for something whole food. I'll give you an example. Instead of getting a McDonald's apple tart like that, like dessert, get an apple, right? That's a silly example, but you get the point. All right. There's a lot more that we could talk about as it relates to nutrition. I'll wrap up just by talking about some vitamins and minerals and supplements that I find to be somewhat helpful. I like my patients to take D3. I've talked about that many, many times. I also like my patients to consider taking a multivitamin. Why? Because not everyone has the green salads and fruits and vegetables of lots of different colors, and we may not be getting all of the macronutrients, and so adding a multivitamin kind of covers our bases. Beyond that, I really like people to have omega-3 fatty acids. You can do that by eating flax seeds. You can do that by fish oil. There's a lot of different ways of doing omega-3s. And then beyond that, we start to get into specifics, like specific supplements for spasticity or specific supplements for energy. So I'll wrap up the first aspect of wellness, of lifestyle, as it relates to MS, as it deals with eating. The second one is sleeping. Now, you might say, well, Dr. B, you're saying stuff that my mom says, except your mom was right. And getting restorative sleep is critically important. It's important for all humans, but it's more important for someone impacted by MS. People impacted by MS don't have a very large functional reserve. They don't have a deep bench, and they can burn through their neurologic functional reserve pretty fast. We need to do any and everything possible to optimize your energy levels. So if you're getting cruddy, poor sleep, you're cutting your legs off before you even start your day. A lot of people with MS have a sleep disorder. Not most, but plenty of people do. They have MS and they have obstructive sleep apnea, where they snore and stop breathing at night. They have MS and they have restless leg syndrome, which makes it hard to fall asleep. They have MS and they wake up to pee 5 times a night. They have MS and they wake with spasms and cramps and Charlie horses. My point here is there's a lot of things that go on during sleep which can wreck your sleep hygiene. And if you're not getting a minimum of 7 hours of restorative sleep a night, you have work to do, for real. We're looking for a set bedtime and a schedule of at least 7 hours where you could be asleep. Don't budget for 5, budget for 7 to 8. We need the room to be pitch black, because any light, even a night light, when it hits your eye, tells the pineal gland, good morning. And so you need it to be pitch black. It needs to be cold, because if it's hot, you'll wake up. And it needs to be silent. We need to not have husbands and children and dogs and cats and neighbors coming in and out of the room. We need the family to understand that when it's time to sleep, that is sacred, because lack of quality sleep makes everything in MS worse. It makes depression worse. It makes cognition worse. It makes energy level worse. Big deal. Sleep is very, very important. If you are a snorer, and if you're not sure if you're a snorer, ask your spouse. If you are a snorer, bring that up to your neurologist, because they may be treating you for MS fatigue and you have obstructive sleep apnea as well. So you want to make sure that sleep is a priority if you're going to live your best life despite having MS. Number 3 is exercise. And simply put, you need to exercise as part of your lifestyle if you're going to make MS boring. If you flip that upside down, if you don't exercise as part of your lifestyle, you will end up more disabled towards the end of your life. And I don't want that for you. Exercise is both super, super important and hard to do with MS, which is not fair, but that's true. And I want to spend just a few minutes kind of talking about ways that you can approach exercise. First of all, I need you to divorce yourself from the high school mentality of, if I run 1 mile on Monday, I can run 2 miles on Tuesday. And if you can run 2 miles, I can run 3 miles. But if we just take a day, we'll just quit. It's kind of an all or none. And the reason I bring that up is a lot of us harken back to the glory days of high school and college when we were athletes, and we don't know how to exercise as part of our lifestyle as an adult with responsibilities and children and MS and all the things. So instead of having that high school all or none mentality, I want you to have a lifestyle of exercise, which means you just do it as part of the fabric of what you do. And you're not rewarded when you do it, and you're not punished when you don't do it. It's just something that you do. So for example, if you enjoy when the weather's out going for a walk after dinner and it's raining like all heck, you're not going to go for a walk that evening. Maybe you'll do it the next morning. It's just part of your lifestyle. Now, when you're thinking about exercise, there's 4 elements to exercise that we really want to harness in the setting of MS. Number 1 is balance. It's not strength. Number 1 is not anything else. It's balance. And if you're not doing exercises to optimize your balance, we have work to do. Number 2 is core strength. Number 3 is limb flexibility. And number 4 is cardiovascular endurance. So just to say those again: balance, core strength, limb flexibility, and cardiovascular endurance. Those are the 4 aspects of exercise that I want us to be thinking about. Now, it's very rare that you do all 4 all at the same time. It's kind of hard to find an athletic event like that, maybe like jiu-jitsu or something, or mixed martial arts. And that's not a bad thing. I just want you to call out, okay, today's exercise is mostly stretching and flexibility. Today's exercise is mostly just balance. And one of the things that's important as we exercise as part of your lifestyle is that it doesn't feel like punishment, right? It needs to not be something that you hate, because I need you to get used to doing it and do it on a regular basis. How often? Again, we need to fit it in your lifestyle. If you can exercise once or twice during the work week and once during the weekends, I think that we're off to a really, really good start. And 2 more pro tips. Sometimes it's super hard to figure out how to exercise because MS has made you have a weak leg and it made you off balance. And so you're not sure like what you can do or not do safely. And that can be really frustrating. Ask your neurologist to refer you to a physical therapist. Go see a neurophysical therapist and say, hi, I need some help figuring out how to exercise. They will be delighted to help you develop a home wellness program. It's a very easy way to put together a rock star way for you to get your exercise on. All right, the last tip about exercise before we move on is water is magic. People can do things in the water that they can't do on land. If you have a really weak leg and it's really hard to walk on that weak leg on land, you don't weigh as much in the water, and you can bear weight on that leg oftentimes in the water, which is really great for mechanics and for confidence. If you are really off balance and you tend to fall to the left, the water pushes back to the right. If you get overheated really easily, well, when you're in the water, it wicks the heat away from you by convection. Spasticity is decreased in water. So my point here is there's a lot of things that you can do in the water that you can't do on land. And I'm going to tell a story of a dear patient of mine who's now passed away. He was my math teacher when I was in high school. And as an adult, he was my patient with primary progressive multiple sclerosis. And this was in an era before there were medicines for PPMS. and he was a really tall guy, like really tall, like, well, for me tall, like, 6'7", and he was having an increasingly difficult time walking, and he was using a walker, but he was needing to use his wheelchair more and more, and he didn't like that, and I didn't like that. And so we hatched a plan. He lived near a YMCA, and he went to the YMCA with a throwaway walker and a life jacket. And he got in the pool with the life jacket and the throwaway walker, and he did laps. He was just in the shallow end, he did laps. And he did that for weeks and weeks. And then he came back to see me in clinic. And my MA at the time says, hey, Dr. B, he won't do his timed walk until you come out in the hallway. So I came out in the hallway, and he looked at me, and he was standing there with his walker, and he said, young man, are you ready? And he picked up the damn walker, and he walked 25 feet with nothing. That was not some magic medicine that a doctor came up with. That was my patient exercising, and by sheer force of will, he was able to get himself walking, and he maintained his ambulation for quite some time after that before he ultimately had to sit in a chair. So I miss that guy. Now, moving on, because I'm talking about 5 aspects of wellness today. The 4th one is mindfulness. And if you're my age or older, you may not have heard of mindfulness because we certainly weren't taught it in school. The definition of mindfulness that I like is being in the present moment without prejudice. So what that means is I'm thinking about an event, or I'm participating in an event in the now, in the present moment, and I'm not worried about something that I did wrong yesterday. I'm just focused on the now, on the event. I'm not nervous about something that's going to happen tonight. No. I'm just focused on the event. And mindfulness, just to give you some examples, meditation is a good way to be mindful. Breathing exercises, that's what I like to do for mindfulness. Yoga is mindful. Tantric sex is mindful. Walking in the woods is mindful. Bible study is mindful. You can kind of make any activity mindful if you focus on it. You can make a family meal mindful if you turn off all the peripherals. You take some time to thank the people that made the food and to really appreciate the food. You take a moment to smell and taste the food. Lose yourself in the moment for 5 minutes eating a meal. Why am I asking you to do this? Because stress makes MS worse. Literally, stress makes MS worse. And I hate it when doctors say dumb stuff like, remove the stress, honey, as if you could like cut the stress off. You can't do that. But we can learn to manage stress. And managing stress is a life skill, and practicing mindfulness every single day for 5 to 10 minutes is a good way to do that. So I've shared with many of you before that I do a mindful activity once every day. I have a lifestyle of showering in the morning so that I don't offend my patients by stinking. And when I finish my shower, I sit on the floor of the shower for like 5 minutes and I go through a breathing exercise. I really like to do that because normally in the morning it's on. I'm like running to get to clinic and it's very, very busy. So sitting and being quiet and breathing for 5 minutes helps calm me, and it helps me to be, I think, a better doctor. So you don't have to do that, but I want you to do something, pretty please. All right. The 5th thing that I'm going to focus on today as we talk about lifestyle and wellness to up your game and to make MS boring is things to avoid. Because there are things that I want you to be doing. Exercise is part of your lifestyle, eat smart, get proper sleep, be mindful, but there's also some things I need you to not do if you want to live your best life. So the biggest one is smoking. Smoking doubles the risk to develop MS, which is really scary. And if you already have MS, smoking speeds the disease up by about 50%, which is a really, really big deal. But if you quit smoking, you can slow it back down. And so I really want you to understand the importance of smoking and not smoking in MS. It's a really, really big deal. And if you were to make one big change, working on not smoking would probably have the biggest impact. What else do I need you to avoid besides smoking? Well, I want to say that I want you to avoid any kind of smoking. All right. So in the modern era, a lot of people enjoy cannabinoids and cannabis. And I feel that cannabis can help with a lot of MS symptoms, but I don't want you to light it on fire and have smoke and suck in the smoke, because that's very, very pro-inflammatory. So that's something that I need for you to avoid. Lastly, I need you to have a good, healthy concern or skepticism when you're looking at something that is not proven. So if you go to a health food store or wellness store and say, hi, I have MS, watch what happens. They'll descend upon you and say, you should try this, you should try this, try this, this is good for you. And a lot of times there isn't data to support that it works or not. And it's not vetted by the FDA, which doesn't mean it works or doesn't work. It just means we don't know about it. So I want to leave you with 3 things that I want you to be thinking before I, Dr. B, would okay a complementary therapy. Number 1, it can't be too expensive. So if someone's recommending a complementary therapy and it's too expensive, we should avoid that. Number 2, it can't be dangerous. And there are complementary therapies or natural therapies that are very dangerous. So for example, cyanide is natural and it'll kill you. Number 3, it can't be instead of something that we know works. So for example, if you said, hey, Dr. B, I'm going to stop my Tysabri medicine and I want to start this supplement, I would be very concerned about that. But if the thing that you're looking at taking is not too expensive, it's not dangerous, and it's not instead of something, then I don't think we have to avoid it. So that will conclude my didactic portion tonight. Thank you for giving me an opportunity to talk a little bit about how to help you live your best life with MS and how to make the disease boring outside of medicines, wellness, eating right, eating smart, getting adequate, proper restorative sleep, at least 7 restorative hours a night, exercising as part of your lifestyle, daily practice of mindfulness, and things to avoid. You got to keep that top of mind. So I'll kick it back over to Stuart and we can switch over to a Q&A session.
Person is asking, I have severe right leg foot drop and also to my right ankle can swell the size of a navel orange. What's going on? Any ideas?
So, you know, the caveat that I have to give that I can't see you or examine you, and so I can't give you medical advice, but I can speak generally about that. So 2 things. Foot drop is really common where it's hard to, if this is my foot and this is my leg, it's hard to lift the foot up to clear the ground. And that's a really big problem in MS because the turf monster can grab the bottom of your foot. You can flip over and go to ground. And so if you're noticing that you have a foot drop, or if you're noticing that your foot starts to slap after long distances, there's lots of things that we can do about that. There is literally a device that you can buy on Amazon called a foot flexor, which is like 20 bucks. And it's a little Velcro strap that attaches around your ankle and then latches onto your shoelaces and kind of pulls your foot up. And that works for a lot of people with a very mild foot drop. Sometimes that's not adequate and we need to have special kinds of braces made. There's something called an ankle foot orthosis, which is kind of like a piece of plastic shaped to your foot like this, where you step into it and it keeps your foot up. There's even medicine by Edison, these electrical devices like an InterStim device, which you place on your calf and it can fire the muscle in the front of your leg to pull your foot up. So there's a lot of things that we can do. Now, you said you notice that sometimes the bad leg swells. This is very, very common. When you are able to move both legs, you fidget both legs. You're constantly moving both legs, bopping about. And when you walk, you're constantly flexing your calf. Fidgeting and flexing your calf pushes the blood back up towards your heart. When you have a bad leg, generally speaking, that leg does not move as much as the good leg. And because it's more stationary, blood flows down because of gravity and because your heart's pumping, and it doesn't flow back. So what do? Well, obviously, you need to make sure that you're checking with your doctor because there are other scarier reasons that you could have swelling. But if it's what I'm talking about from inactivity, then there's some things that can be done. For example, you can sleep with your feet above the level of your heart. And that way, when you're sleeping, all the fluid will drain. And then before you get out of bed, you can put on something called TED hose, TED hose, or Job stockings, which are really tight and they disallow the fluid from coming back. Great question.
Very good. Very good. Thank you so much for that. All right. For those, there were a lot of people that just came on in the last few moments, and I want to just say that Dr. Boster did his didactic in the first 15 minutes of the program, and we are now just in Q&A. So if you have any questions for the doctor, just type them in. Okay. Use the tab at the top of the screen, the top of the toolbar that's red with an arrow in it. Just click on that and type your questions. All right, great. Next we have many. Do you recommend menopause hormone therapy for women in menopause? Any impact on MS, good or bad?
Really, really important topic. So thank you for asking that question. So menopause kind of sucks. And it's particularly yucky in the setting of multiple sclerosis. So this has been studied, and I always like to give a shout out to a doctor named Riley Bouvet, who's a professor at UCSF, a friend of mine who's done a lot of research in this area. And I love to read her papers on this topic. When you go through menopause in the setting of MS, we tend to see decreased frequency of relapses, which is good, but we see an increased risk of progression of disability. You can get worse faster. And in the setting of menopause, there's a bunch of symptoms which are really, really frustrating, like irritability, insomnia, fatigue, worsening depression, bladder problems, bowel problems, sexual dysfunction. There's a host of things that are yucky. So we don't have to accept that just laying down. And I am a big fan of hormone replacement therapy. Now, in past years, hormone replacement therapy was scrutinized, and there was some scary warnings which have been removed recently. So this is a decent topic to discuss with your primary care doctor or your OB-GYN. And what we have found is when you supplement estrogen, it can have a massive benefit, not just to hot flashes and vaginal dryness, but to a lot of other things like cognition and fatigue and bowel and bladder. So if you're noticing that you're perimenopausal, your menstrual cycles aren't as regular, and you're noticing an uptick of symptoms, that's not you making things up, that's real. And get you to the doctor so that we can do something about it.
Thank you. So the opposite of that, a gentleman just asked, what about testosterone for guys?
So whereas estrogen is the primary female secondary sex hormones, the primary male secondary sex hormone is testosterone. And it turns out that men with MS who have low testosterone tend to progress faster in disability and tend to have worsening cognition and tend to have worsening difficulties in the bedroom. And so it's really, really helpful to supplement testosterone. I actually check testosterone levels in all the gentlemen I take care of. And if the testosterone level is low, I'll refer them to the friendly neighborhood urologist so they can supplement their testosterone. And I like to drive those levels up. And typically it's associated with a lot of really good positive things. So I think that's a very reasonable thing. And if you haven't had your free testosterone level checked, it's worthwhile asking your neurologist to order one.
Okay, thank you. Next, the person asks, how to rebuild nerve issues in the, as you call them, the down theres. Okay, how to bring back the sensation from the down theres.
So this can be difficult, and I would enlist the expert help of a pelvic floor physical therapist. So a pelvic floor physical therapist is what it sounds like. And my favorite pelvic floor PT up here in Columbus, a woman named Karina, she said, hey, Boster, make sure you tell them I get up in their business. And working with a pelvic floor physical therapist can teach you how to reactivate your pelvic floor and help bowel, bladder, and bedroom. And so if that's not something that you've explored yet, I would absolutely do that because it's a really big bang for your buck. But let me give you one other tip. And so I want you to purchase something that you can buy online called a Hitachi Magic Wand. It's a Japanese back massager. And it's a plug-in-the-wall vibrator. And it can help big time. Let me explain why. Sometimes when you can't feel the down theres, it's not because your partner's not trying or you're not trying to stimulate the down theres adequately. It's that the message has to travel up your spinal cord to get to your brain so your brain knows, oh yeah. And if there's damage along the spinal cord or in the brain, the message might not get there. So your partner may be working their tail off literally, and the brain is not being informed what's going on. And so we can sometimes overcome that by providing what I call overdrive stimulation. So a plug-in-the-wall vibrator can be brought into the bedroom. You can use it before intercourse, during, you can use it by yourself, you can use it on Saturday. The point is sometimes you need high amplitude input to overcome the barriers in the spinal cord and brain so that you can get the message to the brain so the brain knows what the dealio is. So grab yourself a water-based lubricant because that increases skin sensitivity, and purchase a Hitachi Magic Wand. It'll be the best $50 you've ever spent. Great question.
Awesome, thank you. Next one, person writes that she was diagnosed with MS years ago and recently diagnosed with cancer and was told to come off of a B-cell therapy and put onto another medication. But she actually wants to know from you, though, what do you feel is safest?
So I don't have enough information to answer. There's a couple of really, really important things that I don't know. Like, for example, the kind of cancer makes a really big difference. So without that piece, it's really hard for me to comment. I definitely think that you want to have a three-way conversation between you, your treating oncologist, and your treating neurologist. They need to be in communication. And oftentimes when my patient is diagnosed with a cancer, we'll have a phone call with the oncologist, and the oncologist and I will game out what we're going to do and what we're not going to do, and which medicines we're going to continue and which medicines we're not going to continue. So that's definitely an important conversation that I would recommend having.
Okay, great. Thank you for that. Next one, do you recommend any multivitamins?
I do. Kind of like I was talking about earlier. If you had a perfect diet where you got all of the minerals naturally by eating large amounts of salads with greens and lots of fruits and vegetables of different colors, you wouldn't need to take a multivitamin. But the reality is that a lot of us do not have this hypothetical perfect diet. So I think taking a multivitamin is a nice way to cover our bases.
Awesome. What do you say about vitamin K? Somebody's asking about that.
So a lot of people will see that their vitamin D on the label says D3 plus K2. Right? And so when they say vitamin K, I assume they mean vitamin K2. Simply put, vitamin D does a lot of things. And it does a lot of things for MS, but separate from that, vitamin D helps bones by pushing calcium in the bones. So more vitamin D, it helps bring calcium into the bones. Vitamin K2 helps vitamin D push calcium in the bones. So when you find a bottle of D3 plus K2, that's very safe. And the K2 will help you, but not with MS. The K2 will help you by increasing calcium density in your bones, which is a really good idea.
Thank you. Next person writes, while you sleep, can clenching your fingers so tightly in your fist that it wakes you and you can't pry them open for a few minutes can this be related to the MS?
100% it is. That's spasticity. So like we'll use my hand as an example. In the setting of spasticity, oftentimes the muscles that flex are stronger than the muscles that extend. And when you have spasticity, you can end up with a situation where you have a clenched fist and you can't open it. And I even can have patients that will end up cutting their hand with their own fingernails, or they'll develop yeast infections inside their hand because they can't open it up. And if it's like that long enough, the tendons can become contractured and it doesn't open. And so that's something that can be very painful, and it's something that can cause a lot of problems. So you don't want to just let that happen. The very simple thing to do is grab a face towel that you would wash your face with and try to pull it in between your hand. I don't know if I'm looking for, we'll just use this as an example. So you kind of hold it like this. So at least there's some space in there, all right, with a towel. There's other things that you can do to put in your hand. They even make splints that you can set your hand in to keep your hand open. There's other things that you can do, like you can Botox. Now this is weird, but the muscles that do this are actually down here, which is strange. So they're not up here, they're down here. So the neurologist can Botox to help relax your muscles so they don't do that. And we can do things like take baclofen. So the last thing is the easiest, and that's to stretch. So stretching your hand can actually help it not spasm. Before bed, I would stretch your hand. And here's the key. You have to hold it each rep for 30 seconds minimum. So 30 seconds is a really, really long time. But I would stretch out my hand several repetitions before bed, and that will decrease the frequency that you spasm.
Thank you. A person recently showed me that their hand that the fingers like join up and or that thumb gets locked up in a position. Is that like similarly the same thing?
Yes. So what's happening is it's just all curling in, and it's not necessarily curling in nice, like all put together. It can sort of be like this or like this.
Gotcha. All right, next. Recently, a person told me about a drug that went on to generic, and recently that same person asked, what happens if all the drugs go generic? What do we do if research or the FDA don't come up with allowing any new meds to come onto the market and everything goes generic?
So I think that's a multi-layered question. First of all, what is a generic? So when a manufacturer develops a medication and they get FDA approval, they have a runway of about 10 years where they have exclusivity. No one else is allowed to make that medicine, only they are, and so they can sell it. And they really try to recoup the hundreds of millions of dollars in research that they did the last 20 years to develop the drug during that time when they have exclusivity. After about a decade, they lose their patent on the drug, and then another manufacturer can choose to make it. And so all drugs go off patent after a certain amount of time. And at that point in time, it's kind of a free market for generics to be made. And a generic is where a different manufacturer says, I can do that. And they make that drug in their lab and they sell it. Generics are not always bad, right? So generics are less expensive. And there are times where access to the generic makes the drug available. And I'll give you a roundabout odd example. There's a medicine that I'm very fond of called Aubagio. The scientific name is teriflunomide. I didn't make that up. Teriflunomide is actually a first derivative of a prodrug called leflunomide, all right? And leflunomide was originally a drug called Arava. Arava was a prescription drug for a different condition called rheumatoid arthritis, and it's now generic. So I can get generic leflunomide, and when you put generic leflunomide in your mouth, the first metabolite is Aubagio. How much does generic leflunomide cost? About $20 a month. So that's an example where, by virtue of having a generic, some of my patients that otherwise would not have access to medicines can take a medicine. Now, the question was, what happens if the FDA doesn't allow new medicines to be made? And I don't think that there's any risk of that. As goofy as some of us may feel the government or the FDA is, I don't think the goal is to not make medicines. And I definitely think that there's a very, very robust pipeline of medicines being made. We have to have a grain of salt when we consider a generic, because sometimes they don't behave like the branded drugs. But it's not as if brand is good and generic is evil.
Okay, thank you. So my next question is probably going to take you a few moments to answer, and that would be great. You recently, I'm going to cut in and ask a question for everybody. You recently produced a video on all the different codes now being used for MS, all right? And I think this is a very important topic, so I want you to take the time and repeat this to everybody online so they can understand what's going on.
Absolutely, I'd be happy to. Last year was a really weird year for our understanding of multiple sclerosis, because two seemingly diametrically opposed things happened. One thing in my mind was a step forward, and another thing in my mind was kind of a step backwards. So the thing that was a step forward is the newest rendition of the MS diagnostic criteria. So we call this the 2024 revised McDonald criteria, which came out at the end of 2025. And one of the things about this new criteria that to me is the most important and the most meaningful is that we now have an understanding and a recognition that whether you present with a progression, like primary progressive, or whether you present with attacks, we can use the same diagnostic criteria to diagnose you. What does that mean? It means that there's one underlying biologic disease, multiple sclerosis, that can manifest in different ways. So just because you present one way doesn't mean it's a different disease than someone presenting a different way. It's really one disease. And I'll use an example to help you understand that. So there's a different autoimmune disease called diabetes. And one person with diabetes can be blind because the diabetes hurt their retina. Another person can have perfect vision, but they can lose their kidneys because the diabetes damaged their kidneys. Another person can have perfect vision and kidneys, but they can't feel their feet because the diabetes destroyed their nerves. All three of those people have exactly the same biologic condition, diabetes, but they present very differently. And so us calling in the scripture that you can have one diagnostic criteria really speaks to the fact that it's one disease. So that's the thing that I thought was really great, because that improves our understanding of the condition and allows us to be more effective in treatment. Here's the thing that was kind of diametrically opposed. At the same time, the same year that we came up with this unified diagnostic criteria, the government changed the coding for MS. So when a doctor sees a patient, we have to put down a agreed upon code, and that's called a diagnosis code. And that's what we use with our insurance companies to bill the insurance and all the things. And for a really long time, the diagnostic code for MS was G35. So G35 meant MS, any flavor of MS. Well, the government decided instead of G35, they would fracture it into 8 different codes. So now you have a code for active relapsing MS and inactive relapsing MS. You have a code for active secondary progressive MS and inactive secondary progressive MS. So you take something which, in my opinion, is really one disease, and then you fracture it into a bunch of different little tiny parts. And the reason I'm concerned about that is not just because it moves us away from our understanding of MS, but I'm very concerned that third-party payers and insurance companies will use this information nefariously to say, you don't have that subtype of MS where we approve that medicine. You have this subtype and we won't approve it for that. And I'm very concerned about that. So that was the gist of what I was talking about in that YouTube video. And so if you want to see it again, then definitely check that out, please.
Great, thank you for that. What is the difference between generics and biosimilars?
So when you have a pill, like if you have a pill bottle and there's pills in it, those pills are chemicals. They're made from chemicals. And there's a chemical formula, and if you get a hold of that formula, you can make that chemical. So when a branded drug that's a pill goes generic, like we were just talking about, then a manufacturer can make a generic. They can make a knockoff, as long as they use the same sort of like chemical compound code, so it looks the same. And then they can show the FDA, hey, FDA, here's the original drug, and here's my generic, which chemically looks the same, so approve it. And one of the things that bothers me about that is when you make a generic of a small molecule like a pill, you don't have to test it in humans. All you have to do is show that it's chemically similar. So sometimes you can create variability from the parent drug, the original branded drug, to the generic. I don't like that. Biosimilar is different. A biosimilar doesn't deal with small molecules like pills. Biosimilar is something that we talk about in the setting of a biologic drug. So certain drugs like the monoclonal antibodies like Tysabri and Teruco and Kesimpta and Ocrevus and Briumvi and Lemtrada, those are all monoclonal antibodies. Those are all biologic agents. They're grown in a laboratory. They're not chemicals. And when those drugs go off patent, you don't make a generic, you make a biosimilar. So a different manufacturer manufactures the exact antibody. They grow the exact antibody. And the thing that I like about biosimilars is you're required to test them in humans. So for example, when Tysabri lost its patent and another company was able to make it, they did. They made a natalizumab product called Teruco, and they did a trial where they compared Teruco against Tysabri, and they showed that it's equivalent. And that's a really big deal because that way we can look at the data and feel confident putting our patients on that.
Great, thank you for that. Can you restore and build muscle with a TENS unit, or an EMS unit for muscles that don't fire up?
So what is a TENS unit? A TENS unit is medicine by Edison. You literally like electrocute your muscle and cause it to contract. And a TENS unit is something that sometimes a physical therapist will help you use to help try to stimulate a muscle. And depending on the underlying problem, it can help. I would not recommend trying to source your own TENS unit on eBay and try to hook it up and shock yourself. I would recommend instead that you take the idea to a licensed physical therapist who can help you do it in a very safe and effective manner.
Great, thank you. What can you tell us then about the psionic?
So the psionic neural sleeve is spelled, it begins with a C. And so if you want to look that up, psionic neural sleeve is a really cool device. Now, I don't have a financial relationship with the company. I just think they make a really cool product. So I don't mind talking about it. It's a neoprene like leg sleeve that goes from the bendy crack all the way down to your ankle. And in full disclosure, it's kind of hard to get on. A lot of my patients need someone to help them get it on. Now, embedded in this neoprene leg sleeve are electrodes, and there's a bunch of electrodes on the quadricep and on the hamstring, and then farther down on the leg in the front, the anterior tibialis, and then on the calf. And it's all hooked up to a fancy pants computer, which works with an app on your phone. And what it does is it can be programmed to help fire the muscles at the correct time to help you move your leg. So earlier when we talked about foot drop, this psionic neural sleeve can help foot drop, but it can also help the rest of the leg. And so for some patients, it's been very, very helpful in getting them to walk farther. Some of my patients enjoy wearing it when they exercise. So they'll do some exercise with it on, then they'll take it off and do some exercise with it off. Some patients have tried it and then after a while have found it not to be helpful. But I think it's a very, very clever device. And I think that it definitely is something to consider if you have leg weakness.
So that being said, I've heard that for those that have gait issues, can the sciatic sleeve then help with weakening hip structure because of the gait issue?
It really gets a little bit complicated, Stu, and it depends on what they're able to do with their hip. So the psionic neural sleeve can't fire the hip very well, the hip flexor in the front. There's a device that I discovered. Well, I mean, I didn't discover, I saw on the internet. And it's called let me remember, the Hypershell X. And this is a device that it's not invented for someone who has a disability, it's invented for a mountain climber. And it's a belt, like a Batman belt, with two bars that then attach to your legs. And there's motors, and it pulls your hip flexors up. And so it was intended, the idea is like you're climbing a mountain, so this assists you in climbing. And I got one out of curiosity, and I brought it to my clinic, and I've had a couple of my patients try it on. And some of the patients that have mild hip flexor weakness, this device is very, very useful. Now, again, I don't have a relationship with the company, and I had to pay full price for one, but it's a pretty clever device, the Hypershell X.
Okay, thank you. So other than this, the psionic sleeve, sorry, what else can you suggest for rebuilding leg? What else can you recommend to rebuild leg strengthening?
The number one thing to rebuild leg strengthening is, or otherwise put, the number one thing to help facilitate neuroplasticity is moving the limb in the correct manner again and again and again and again and again. If you have a connection between your brain and the limb, like I'll use my arm because it's in frame, even if it's weak, as long as there's still a connection, you can strengthen that connection by doing it again and again and again. And so the key is to make sure that and you may need to work with a neurophysical therapist to make sure that you're moving in the correct manner, and then just to hit the repetitions. That is by far the biggest way to facilitate neuroplasticity and to help strengthen those weak connections, make them stronger.
Okay, thank you for that. Next, we have a question about going back to something you were talking about earlier. When you say that smoking, that you shouldn't smoke, person is asking if vaping falls into that category as well. And another person is asking, is there something that is a smokeless tobacco that can be used?
So this is a very, very common question because vaping is very popular these days. And I think vaping might be a little bit socially more acceptable than an analog cigarette in some environments. The reality is we don't know about the dangers of vaping as it relates to MS to the degree that we know about tobacco smoke, like cigarettes, because cigarettes have been around a lot longer. I assume that an analog cigarette is worse for you than vaping, because with an analog cigarette, you're literally sucking in smoke, and with a vape, you're not sucking in smoke. Now, you are sucking in some other stuff, and that may be bad for you, but if I had to pick between the two, I would prefer that you went with the vape, because I think now, but I can't prove that. I don't want you to finish listening to me tonight and say, oh, Dr. Boster said that vaping is healthy. I'm not suggesting that it's healthy. I just think that probably it's a better option than smoking an analog cigarette.
Aren't there a lot of chemicals in the vape?
Yeah. So it's not benign. I'm just saying it hasn't been studied to the same extent. So we don't know what we know about tobacco smoke. I do want to say that I don't think that the problem speeding up MS is nicotine. I think it's the tobacco, the carbon. And so sometimes people will use like vape to help transition off of cigarettes. And I think that there can be a value there.
Okay, so the next question is, sorry, I'm losing my voice again. The next question is smoking weed or doing
Edibles?
Yeah,
Edibles.
that. Right.
So again, I don't want you to take something carbon-based and light it on fire and suck that in your lungs, whether that be tobacco or cannabis. I don't think that's a very smart idea because it's very, very pro-inflammatory. So if someone intends to use a cannabinoid either to get high or because they're trying to treat an MS symptom, I would prefer they didn't smoke it. Same thing about the vaping. Vaping is probably more healthy than smoking, but we don't really know that because it hasn't been adequately studied. The least inflammatory way to consume cannabis, in my opinion, is to eat it. And so a lot of my patients benefit from using edible gummy that they'll take 5 or 10 milligrams with THC, and that can help with insomnia, it can help with spasticity, it can help with pain, it can help with anxiety. So that's a way to do it without risking inflammation.
I've heard some horrific stories about people doing edibles and not feeling it. So figuring that, oh, let me pop another one, you know, and then getting so damn high that they're a danger to everything, right?
So here's the rules for engagement. When you take an edible cannabinoid like a THC gummy, it's not going to kick in right away. In fact, it probably won't kick in for about 45 minutes, and it may peak around 3 hours. Now, if you're a 20-year-old boy, it's very hard to wait 45 minutes or 3 hours, and you may make an error in judgment and redose, and then redose, and then redose. And when it kicks in, you're going to have a really, really bad day. Now, a pro tip, if that happens, go to sleep. You sleep it off, and when you wake up, it should be gone because it'll be out of your system. Here's the rules for engagement, particularly if you're not familiar and you want to make sure that you figure out if there's a benefit to a cannabinoid without having a lot of side effects. What I would recommend is get a tin of gummies, and the first night, cut one gummy in half, 5 milligrams. Finish your dinner and then take the gummy, and then go about your normal evening routine. Don't sit around and wonder what's going to happen. Just go about your normal evening routine. Do not redose, all right? You're only taking the 5 milligram gummy. You're not doing any alcohol. You're just going to see what that does. If it does wonderful things, or if you don't notice anything, that's the only experiment you do that night. The next night, if you didn't notice something with 5 milligrams, then you might try 10. But don't redose. Take your time and try to figure it out.
Great, thank you. Next question. How long is too long to be on Tysabri?
There is no too long, with the exception of an increase in risk. So I guess I would say it's too long to be on Tysabri if you are no longer comfortable with the risk profile. And risk profile comfort is individual for the human being. I have some patients that are JC virus antibody negative, and they refuse to go on Tysabri because they're scared of PML, even though they're not at risk of PML. I have other patients, if they're antibody positive to the JC virus, they don't want to go on Tysabri ever, even if that risk is really, really small, like 1,000th of a percent. I have other patients that have been on Tysabri for nearly 20 years, and they're a JC virus antibody positive, and they understand the risk and they accept it. I'll tell you a quick story about a dear patient of mine who is a retired internal medicine doctor. And the reason I bring that up is she understands medical risk benefit, like really well. She was a physician her whole career. And she is on Tysabri and does great on Tysabri. She's been on it for a really long time. And she's JC virus antibody positive. And I said to her, I said, hey, what are you thinking? You want to continue? And she said, honey, when the risk is 1 in 10, call me. Right? Point here is you can't tell me that she doesn't understand the risk profile. And I think that the answer to what's too long is really individual. So if you're responding to Tysabri and your risk profile is acceptable to you, I would keep on keeping on.
Okay, great. Thank you for that. Do you have an opinion on Cadence shoes for walking or balance issues?
Cadence shoes are cool. That's my opinion. Cadence shoes are clever. So we were talking about trouble lifting your foot up, and I told you about some devices that can pick the foot up. Cadence shoes approach the problem a different way. So let's pretend that my phone case is the bottom of the shoe, right? Like the sole of the shoe. Along the sole of the shoe is a piece of really hard plastic which glides on almost any surface. The back of the shoe has a normal tread. So if you push the heel down, it's a normal shoe, but you can lean forward and slide your foot forward. So if you have a foot drop on the left, but you're rocking some Cadence shoes, you can glide and then take a step and then glide and take a step. And so I think Cadence shoes can be very, very useful.
Great. Thank you for that. By the way, everybody, we are not going to get to all the questions asked because even I typed in, don't ask, we got like 20 more questions, okay? And we're not going to be able to get to those questions. So I just wanted to let you know that Dr. Boster is online with us every other month, and you'll be able to ask him during the next month that he is online, okay? And not only that, but in the month of March, we'll be doing a wellness event in Columbus, Ohio. And during that program, of course, you will see Dr. Boster. You'll also see the person that he spoke about earlier, Karina Syracusa, who's a pelvic floor specialist. And we have a kinesiologist coming in from Chicago, Dr. Robert Model. He's a professor, and he'll be speaking about the benefits of exercise for multiple sclerosis from a researcher's point of view. So awesome. This is something that he does research studies around the United States with MS patients. Okay, so he'll be speaking to you again from a researcher's point of view on the benefits of exercise. So we will have a great conversation going on that day, and of course, you'll see it online. So I just wanted to get that in before we get too late in the program. All right, next question is aerobics and cardio. How do we get to that point if we're not supposed to be overheating?
I would challenge a little bit of what you said. It's not that you're not supposed to be overheated, like getting overheated hurts your body. It's just that if you get overheated, it can cause you to short circuit. So let me clarify that. Some patients, when they start exercising and they raise their core body temperature, old areas of damage short circuit, and they can have what's called motor fatigue. So like they're walking, and if they walk long enough, their left leg starts to get weak, right? And we sometimes will tell people, be careful about getting overheated because that may happen. It doesn't cause damage to your body. Once you cool down, you're back where you started from. And it's important to understand that it doesn't cause damage to your body, because otherwise it would make you super scared to do anything where you got overheated. Sex, going outside, I mean, and so I don't want you to live in fear like that. If you struggle with heat sensitivity, then there's a couple things that you can try to do. You can exercise with a cooling vest on. You can literally exercise in front of a giant fan. Water is magic. Try doing aerobics in the water because it constantly wicks the heat away from your body. And there's a medicine that some people respond to called Ampira, or 4-aminopyridine, or in Europe it's called Fampira, or 4-AP. That's all the same drug. And for patients that respond, it buttresses against heat sensitivity.
Okay, thank you for that. That being said, what's an ideal temperature for people to be walking around outside?
San Diego. It's not Ohio, because in Ohio it gets really cold, like right now, and people get stiff. And then in the summer it gets really hot, and then people get weak. So those fluctuations for some Ohioans can be really rough. I always feel like the San Diego weather is kind of perfect year round.
Great, thank you. A person is asking a general question. Will slides be available? Well, there are no slides on this program today at all right? But all of MS Views and News programs, whether they're virtual or they're in person, every single one of our programs goes onto our YouTube channel. Okay, so you will be able to watch this again on our YouTube channel. It'll be there in less than a week. Okay, and all I can say is go to our YouTube channel via our website, get signed in on there, get registered, click on the thing to subscribe. Okay, and then you'll know about every one of our programs when they become available. So you don't have to hear it from somebody else online. If you're subscribed, just subscribe. Thank you. All right, next one. Person writes, can you talk about PIRA and whether it's a newer focus, and is there certainty of what's happening with getting rid of this from the body?
So we neurologists are kind of nerdy guys and gals, and we like to make up terms for things and to help us understand. And one of the terms that we made up several years ago now is really very useful. It's a term called PIRA, which is spelled P-I-R-A. And PIRA stands for Progression Independent from Relapse Activity. And PIRA is one of the two ways that people with MS can get worse. One way they can get worse is they have an attack and they don't fully recover. So I'll use an example of you have an attack of left leg weakness where you can't move your leg, and then it only comes back halfway. So now you have a limp because you've accrued some degree of disability. And we call that relapse associated worsening, or RAW, R-A-W. There's another way that you can develop difficulties in MS, and that's this PIRA, progression independent from relapse activity. And the way that I want you to conceptually think about it is when you have new inflammatory damage and there's an area of the brain or spinal cord that gets damaged, your brain tries to recover, but that area isn't working at 100%. Let's say it's working at like 99% or 90%. As you age and as your body ages and as your brain ages, those areas of damage wear out faster than the areas that are intact. And so the human, without having a new attack and without having a new lesion on the MRI, can start to have progression of their symptoms, can get worse. We believe that some of our medicines can treat PIRA, but not good enough. And so, yes, it's a massive area of research where we're trying to find ways of addressing PIRA. And so I promise you that the international MS community has PIRA top of mind.
Great, thank you for that. Next, what can you tell us about vibration plates?
I don't have a lot of experience with vibration plates. I have some patients anecdotally that swear by them to help them poop. So they will sit on it and it'll vibrate their torso. I have some patients that have found it to be somewhat helpful for balance, but I don't feel like I know enough about it that I can speak intelligently.
Okay, thank you. What can you tell patients about vitamin D3's use as far as how much they should be taking and why they need to do what I know you can, go ahead, I know what you can say,
So when you look at vitamin D levels, lower levels of vitamin D amongst people with MS correlate with worse outcomes. And higher levels of vitamin D tend to correlate with better outcomes. And so that leads some of us to believe that taking vitamin D may help MS. Others of us don't think it helps, but they agree that it does not hurt anything. And as a result, I think the better part of valor is to supplement your vitamin D. You can get vitamin D from the sun, and so Stuart's heard me say this many times, but if you go out shirtless in full sun for 15 minutes, you'll absorb 5,000 international units of D3, which is exactly what I want most of my patients to take. But in Ohio right now, you would get frostbite, and your neighbors would probably call the police, or your pictures would show up on the interwebs. So that's not going to be a viable option. You can get vitamin D by eating like cartons and cartons of eggs, or by eating an entire salmon, but that's really hard to do and like nonsensical. And so that's why I really like my patients to take a vitamin D3 pill. Now, I try to track the level, and I get labs about twice a year in my patients, and I'll get a D level. It's called a vitamin D 25OH, that's the lab. And I want that number to be above 50, but below 100. That's the sweet spot for me. And so that's what I do. And just to be clear, I'm not asking you to run out and buy a bunch of vitamin D and take it all. I'm recommending that you work with your neurologist so they can check blood levels to make sure that you're on enough.
Great, thank you for that. Next one, person wants to know what you can update us about stem cell therapies.
Nothing. I have no updates on stem cell therapies. So it's still a very active area of research. There's several places around the United States, including the Cleveland Clinic, that are actively enrolling for stem cell therapy. Stem cell therapy is now considered one of the pathways of standard of care in Great Britain for aggressive multiple sclerosis. And it's something that we're still testing. I will caution you with strong language to be cautious about stem cell tourism. There are unscrupulous places around the United States and around the world, and they will be very happy to take your hard-earned money, and they will take out some blood, and they'll go in the back room and do some things, and then they'll come back and give it back to you. And that's not a real stem cell transplant that's going to help MS. So please be very cautious about that.
Okay, thank you so much. All right, a person's asking about Bioness versus the Psionic.
So we're talking about these devices to help you move your leg. And one that they mentioned is called the Bioness. The Bioness is a brand or a proprietary device. The Walk Aid is one of its competitors, and both of them are a cuff that goes around your calf, and it has electrodes that stimulate the front of your bottom of your leg. They call it tibialis anterior muscle to pop your foot up. And that can be really helpful if you have a foot drop, but it doesn't help if the leg is weak higher up, like above the knee. A psionic neural sleeve can do both. And so it can cover more surface area, and it can help not just a foot drop, but it can also help the rest of the leg as well.
Okay, thank you. We're going to take just a couple more questions, all right, because I know you got to go. And the first one is, can you tell us anything about what's happening with CAR T therapy?
I have no new updates since the last time we spoke, except to say that there are centers around the United States that are actively enrolling patients, and that's really, really exciting. I've made a YouTube video on CAR T therapy. MS Views and News has some absolute experts talking about their own CAR T therapy. So if that's something you're interested in learning about, check out the MS Views and News website where you can see that stuff. It's a very, very promising therapy. More to come.
Great, thank you for that. Next one is, somebody's asking how they could contact me. Just go to the website, all right, msviewsandnews.org, all right, and on there you'll find ways that you can contact me, or hey, you just got email from me 9 million times to be on this program, so you can just write to that email address as well. All right, next one is a person says that they've overused too many different antibiotics for bladder infections. Is there something else that can be used other than an antibiotic?
Yes. So if you have recurrent UTIs and you're having trouble with antibiotics, I certainly hope that you are under the supervision of a urologist, because they are sort of the wizards and witches that help with bladder. They're really, really good at it. I also think if you're having problems like that, working with a pelvic floor physical therapist is an absolute must. Those are two things that I think are very, very helpful. There are things that can be done. I'll give you an example of a medicine called Hippurx, which requires a prescription, but it acidifies the bladder and it can help prevent UTIs. So there are things that can be done to help with that. And I think where you're going to find those answers most often is working with the urologist and working with the pelvic floor physical therapist.
Okay, thank you. What can you tell people is the best way to improve balance?
So this will be the last question, and it's a really good question. So thank you for asking that. So there are exercises that help with balance a lot. And the neurophysical therapist is a wizard at helping you optimize your balance. MS Visa News has had a good friend of ours on several times. That's Dr. Gretchen Howley, who is a PhD physical therapist, a neuro-PT, who specializes in multiple sclerosis. She has a fantastic online presence and a great program that many of my patients have enjoyed. The reason I'm bringing up Dr. Howley is because she, in her Missing MS book and in her class, focuses massively on balance exercise. So if you would like to see a bit about that, you can check out her website, and I even have YouTube videos on balance that you can look at.
Great,
Thank you guys. It's been a fun evening.
It has been a fun evening, and Dr. Boster, I don't want you to run away so fast. There are a tremendous amount of things that Dr. Boster is doing for the MS community. He's got shorts online all the time on Facebook. So if you're on Facebook, try to get onto his page, all right, or at least subscribe to his YouTube channel, because every single day you'll find at least one of the shorts that I'm talking about. And when I mean a short, he's not wearing a pair of shorts. He's doing these very
short, just a fast little snippet.
Exactly, a fast little thing, maybe 20 or 30 seconds about something that everybody needs to know about concerning multiple sclerosis. They are excellent. I recommend this to thousands of people every single day, and so I'm going to tell you all as well. All right, so I want to thank everybody that has been online tonight. We had well over 100 people online. It was excellent to see all that. And Dr. Boster, we'll keep on going, all right? You and I, and
very much.
We got a lot to do for those with MS, and for everybody else, just whoever doesn't know, go to our website, look at all the virtual programs that are online, look at all the other programs that are online, and get with us, okay? Dr. B, thank you for being here. I'll speak to you another time. Howdy, good night, bye.